Hello, performance. By now, you're about a third of the way through a pretty significant skills meeting, at least as far as skills meetings are concerned, for a couple of reasons. A, you just saw the introduction to Talent, our new learning management system. Thank you to Lisa and Leah for rolling that out. We're really excited, especially from a clinical perspective. We're really excited to roll this out. The functionality is is a big improvement over what we previously had. This really checks a lot of the boxes we needed so we can get even better content, and it's easier to work through online. We can add surveys so we can get the feedback we want to give better content to our employees, our therapists, our staff, and even better tracking. So we can track CEUs much more easily, and the reporting's better too. So there's a lot we can do with that, and there's a lot more to come. So we're really excited about using Talent, first of all. So now part two brings us to the actual skills meeting, which is the first skills meeting to be held on Talent. So I hope you're here and watching this video and in the right spot. So here we go. The other piece we're rolling out is our Care Measure survey data, all right, that we've been collecting for about 8 weeks now. Big thank you to our PCCs. I'll probably be saying that several more times throughout this video. We should all be thanking our PCCs for this. So probably 50 to 75% of our clinical staff was here over a year and a half ago when we first did the CARE survey. So CARE surveys stand for the Consultation and Relational Empathy Measure. All right, it's a patient-centered process measure that was developed and researched at the Department of General Practice. Let me make sure I get this right. The Department of General Practice in Glasgow University and Edinburgh University in Scotland. All right, it measures empathy in the context of the therapeutic relationship during a one-on-one consultation between a clinician and a patient. So it was originally developed for general practitioners, but it's since been adapted and used by other medical staff, other allied health professionals, nurses, and physical therapists, or physios, as you'll see on the report, because this is used in Europe greatly. So why does performance use this scale that's been shown to be very valid, very reliable? It's been used in over a couple of hundred studies. First, I'll tell you a few of the ways that it's used. The wording in it, you'll probably notice if you have a copy in front of you right now. The wording reflects this holistic, patient-centered measure that's meaningful to patients. It's been shown in research to be meaningful to patients regardless of their socioeconomic status. So it's meant to ask very recognizable, holistic questions like, how much did my practitioner listen to me at this visit that we just had? How much did they care? Questions like that, all right? So it works across all spectrum of all of our patients, all right? Some of the other ways it's used right now, it's the measure of choice for the National Healthcare Services in Scotland for patient feedback. It's used routinely to appraise general practitioners in primary care practice. All the GPs in training in the UK are assessed using the CARE measure. So this is a really legit measure. It's part of the National Quality Measure Clearinghouse in the USA, which is the standard of outcome measures. You know, photos are part of that as well, and several other types of outcome measures. And there's some really interesting research being done. The National Institute of Health in the US just funded a randomized controlled trial, and they actually correlated the CARE measure, which was this measure of the doctor-patient interaction. They said it actually predicted the severity and duration of illness and the immune response during a cold, right? So this reflects how important it is that as providers, we listen to our patients, that they relate to us. It can literally have an effect on their health immediately. So this is quickly becoming a standard. They're using it at universities and medical schools across the US to assess that patient interaction. I'm sure we all know why already, but we can reflect on it a little bit, which is, we all know manual therapy skills are important. We all know our exercise prescription or exercise choice is really important. But we also see it in our patients, we see it in our numbers, we see it in our success stories. The relationship we create with our patients is even more important than the skills we bring to the table. That's the bottom line. We're in a really low-tech field. We use our hands, we use our mind, we use our words to connect with our patients. And those that do this the best get the greatest therapeutic alliance with our patient, and we create the biggest change. We influence them better than others. So this isn't just another number. The reason we decide to do this fairly labor-intensive process on these paper measures is because the number we get at the end is really reflective of our values. Just like we have our outcome measure for clinical outcomes, and we have our numbers for how we're doing week to week, these care surveys reflect how our patients perceive us and how well we're connecting with them. All right, so I hope everybody understands the significance and why we do this. So here's what the actual procedure looked like. Over the last 8 weeks, our PCCs, without asking you to do much, right? Our therapists were able to just treat patients. Our PCCs, and in some cases our exercise specialists, when a patient was leaving, went right up to the patient and says, please fill out this one last survey. It's entirely anonymous. It's about the therapist you saw today and about how you feel right now after this visit. All right, it's not about anybody else. It's the therapist you saw today, how you feel immediately after the visit you just had, anonymous, right into the envelope. Our PCCs had to collect at least 25 surveys, but almost, I believe everybody got at least 30 surveys. You need 25 for the data to be significant. We got at least 25 to 30 surveys. We then input the data manually, and everybody's going to get this report printed out that you'll see in just a minute. So what you'll find when you open up your envelopes in just a moment when this video is over, you'll get your gross score, what your average score was, but then you'll get the percent ranking, just like you do with photo. You'll get your percent ranking versus all other physios, you know, the thousands that are in this database as well. You'll then get the same ranking for every single question. So each of those individual questions, you can draw your own conclusions about where you are. Just a quick note, before you leave, please give them back to your clinic directors. You're going to see not only your printout, but the raw data too. You'll see all 25, 30, 35 surveys. In some cases, patients write some comments as well. Use them, look at them. It's your data. Give it back to your CDs just so they can record it. It's going to be part of the quickies because, you know, we measure what matters, and those scores will be on your Q4 quickies in just a month or so. So as soon as this video is over, as soon as I'm done talking in just a minute, you're going to stop the video. You're going to look at your own surveys. The next slide has some questions just to think about as you look. Feel free to have a discussion amongst yourselves in your own clinic and what it means to you, whether the scores are what you expected, if they're not. And then immediately after, we'll have a video from a very special guest that spoke to us previously, who has some phenomenal experience and some great talking points. So instead of hearing it from me, you're going to hear it directly from an expert whose whole job is to create a strong therapeutic alliance with his patients. And he was kind enough to take some time out to give us some tips. So we're going to see those tips, and then we'll hopefully everybody will get a lot out of their care measure. They'll use it to reflect on their own care, just as we practice our manual therapy skills. 11 out of the 12 skills meetings we have every year, this is the one where we can reflect about how we relate to our patients and how we talk to them. I hope everybody gets a lot out of it. Don't forget to also take the quiz and the survey. This is the first time we're using Talent, and there's a lot we can do with that data. I appreciate it, and good luck. I hope there are some great conversations. Thanks.